Picture this. You've been having contractions for hours. Everyone's excited. Cameras are also ready. But nothing's happening. The cervix is just chilling at 2 centimeters like it's on a vacation. I am Andrea Carmela Munda from BSN 2A of Bicol University Polangi, and today we're diving into the common types of dysfunctional labor. Normally, labor is a smooth process, but sometimes the uterus gets a stage fright. It either works too hard or not hard enough. First up, the first stage of labor. This is where the cervix opens or dilates. But what if it doesn't? Well, we get a few different types of dysfunction. In a normal labor, early contractions help soften and open the cervix. But in a prolonged latent phase, it feels like we're stuck in warm-up mode forever. It takes like more than 20 hours if it's your first baby, or more than 14 hours if you've done this before. The cause? Maybe the cervix wasn't ripe enough, or pain meds were given a little too early. The uterus is working way too hard, and we call this hypertonic contractions. But they're too weak to actually make a difference. Rest, fluids, morphine, and dimming the lights can calm things down. Next is protracted active phase. This is when the cervix is opening, just way too slowly. It takes less than 1.2 centimeters per hour for preemies and less than 1.5 centimeter per hour for multis. It is often because of fetal malposition or the baby facing the wrong way, or CPD, which is what we call as the cephalopelvic disproportion, meaning the baby's head is just too big for the pelvis. If there's no CPD, oxytocin might help. But if there is, we must prepare for surgery. If the cervix slows down after it's already halfway there, that's called a prolonged deceleration phase. The deceleration phase is like pausing right before the finish line. If it lasts longer than 3 hours for preemies or 1 hour for multis, something's probably wrong with the baby's position. The most likely solution for this might be a cesarean. Next, secondary arrest of dilation means things were growing great and then stop. No cervical changes for more than 2 hours. If the baby is not moving and the cervix is not dilating, we may need a C-section. Now, onto the problems in the second stage, which is during the descent of the baby, or when the baby is going down the birth canal. The first one, prolonged descent, means the baby is moving down the birth canal, just really slowly. Less than 1 centimeter per hour in new moms or 2 centimeters per hour in multis. We can manage this problem by hydrating the mom, adjusting her position, maybe rupturing the membranes, or starting oxytocin therapy. If no descent happens for 2 hours in preemie or 1 hour in multi, it is called the arrest of descent. The most common culprit, again, is the CPD or cephalopelvic disproportion. If the baby can pass through the pelvis, C-section is often the answer. Dysfunctional labor isn't just about the body. It hits emotions hard too, especially the mothers and the families. They suffer from anxiety, fear, and discouragement. And this is why how we explain things matters. As we've seen earlier, labor can be a roller coaster. Knowing where the dips and delays can happen helps us guide it safely and compassionately to the finish line. Remember, the types of dysfunctional labor are prolonged latent phase, protracted active phase, prolonged deceleration, secondary arrest of dilatation, prolonged descent, and arrest of descent. Learn them, spot them, and respond early. Thanks for riding along. See you on the next case.